where they live. In the ventricles, there's only three things you can actually develop. So let's say something is cooking in the ventricles, okay? This is another review. Only ventricular fibrillation, which is not good, right? Ventricular tachycardia, okay? So VTAC, VFib happens inside the ventricle. Or you can have a PVC, a premature ventricular complex. A premature ventricular complex. Okay? That often looks like this. So you've got P wave, QRS complex, T wave, and then you got P wave, QRS, T. And this will be a PVC. A PVC is just like a little ectopic focus inside the ventricle that fires, blip, and just kind of occurs like that. It's kind of wide, okay? And that is a PVC. Now, if the patient is having a lot of symptoms with their premature ventricular complex, usually it's a very, very benign. We don't usually treat this. So, but except it's causing problem, patients become hemodynamically unstable, but that's not good. Ventricular tachycardia, we already explained it before, it's same thing. Ventricular fibrillation, on the other hand, is because now, remember how we have atrial fibrillation? I call it the dancing atrium. Well, just like everybody wants to take over, I don't know why. When you go into the ventricles, in ventricular fibrillation, there's so many spots. It's like stars just exploding, like fireworks exploding inside the ventricles, right? In the right ventricle and the left ventricle. So what happens is there's so many firing, there's discoordination instead of a nice coordinated depolarization and contraction that causes ventricular fibrillation. And you can use procainamide, especially for ventricular tachycardia and ventricular fibrillation. Now, how are you going to be tested on the boards? Well, let's talk about the side effects of this medication. So, board question. Board question. Side effects of procainamide. And I'll tell you what the side effects is, and then we put it in a board style question. Well, the major side effects is lupus-like syndrome. Lupus-like syndrome. Whoa, 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 whoa. Lupus? Yeah. This is one of the drugs that causes lupus that you must, I repeat, you must know for your boards. This is very, very, very important. This you will be tested on. They love to test this. Okay. Why? Because this is a drug-induced lupus. Okay. So usually, this is how the question is going to present. See, a 55-year-old male presents to the emergency department with chief complaint of fast heart rate, right? On EKG, the patient had EKG that looked like this, okay? I'm trying to draw ventricular tachycardia, okay? So the patient had ventricular tachycardia. I'm telling you now, this is VTAC because they're white complexes, and I'm trying to make them regular, but not necessarily as regular as I should, but all right. And the patient was started on the medication. The patient was sent home and then presents to the office with complaint of a rash over his face and some joint pains. You look at the patient's face, and the face looks like this. They've got a butterfly rash over their face and they're complaining of joint pain. Huh. What do you think this is? Well, that looks like a lupus-like rash. So what actually happened is procainamide is causing the patient to develop lupus-like syndrome. And what happens is they make antibodies against the drug and then cause a cascade of inflammation inside the joints, in their knuckles, in their knees, wherever the joint pain is. So they start complaining of pain. And then they get photosensitivity and they develop a rash on their face. But that is not lupus from the autoimmune. It's drug-induced lupus. And the drug that's causing it is procainamide. Procainamide. Okay? So that is very, very important. That's very important. So, also, procainamide, which start with the letter P, can cause pleuritis and pericarditis. So I call it the 3 P's because procainamide can cause pleuritis, pericarditis, and lupus. Like the P for the lupus. Okay? So that is very, very key. You must remember that for your boards. Okay? So now let's talk about the department. Okay? Diisopyramide. Now, diisopyramide basically is the same drug like this, guys. There's nothing special about it. It's a sodium channel blocker, okay? And the only other thing with it is just it has a stronger anticholinergic effect. Okay? Has a stronger anticholinergic effect, which means the patient can also have dry mouth, constipation, okay, urinary retention, okay, blurry vision, and so on and so forth. Okay? So, but it can cause torsades de pointes, which is just a polymorphic ventricular tachycardia, which basically looks like this. It's polymorphic because it's many different shapes of QRS complexes and it's very fast heartbeat. That's what torsades is. And we're going to talk about torsades in another lecture. And that's all we know. And that's all you need to know for the top 3. Remember, police department questions, right? Procainamide, disopyramide, and quinidine. Now, moving on to the little man. But before we move on, I really want to draw out the graph so we are keeping track of this, okay? Before we move on, I need to quickly talk about that class 1A again. Remember when I drew the graph and it looked like this? When the class 1A drugs work, this is how they work. Okay? That's class 1A drugs. Okay? See how they prolong the effective refractive period and they make it really, really longer. Because we're going to be talking about class 1B, where the little man is, before we question him for prostitution, you know, for the prostitution that he's engaging in. Because class 1B is still class 1. But they're still sodium channel blockers. They're still sodium channel blockers. But they have an effect on the effective refractive period. The effect they have on the effective refractive period looks like this. Let's use blue for class 1B. Okay? So they also block sodium channels, so they have a little slope. But what they do is see how the effective refractive period is a little bit shorter for class 1B. This is class 1A. So B, A. This is 1A. They prolong the effective refractive period because they block big time. Okay, they block it really, really well. So now, let's talk about class 1B. Well, there are three drugs here. The little man, the first T stands for tokenide. Tokenide. And we're going to talk about him. The little one stands for lidocaine. And the man is mexiletin. Mexiletin. Now, if you guys really want to hear another mnemonic in this department, if you don't want to commit all these three to memory, you can either say pros don't quit, okay? And then you can say love Mexican tacos. That's another mnemonic you can use. But I know it just gets too much mnemonics. Yeah, I figure let's just stick with the police department. But anyway, these are class 1B. And they also blocks activated and they block both the activated and the inactivated sodium channel. But they exert a greater effect on the inactivated sodium channels. Okay? So what they do is they decrease the slope of phase 0, which is phase 0, and phase 4. Okay? So they decrease the slope of phase 0 and phase 4. See how that comes down that way? That's decreasing the slope. Okay? So they block both the activated and the inactivated sodium channels and decrease the slope of phase 0 and 4. Because I want us to be able to keep track of this. This is very, very important also. So, let's start with lidocaine, right? Lidocaine. So, that's the little guy. Drug name, lidocaine. I love lidocaine because I use it all the time in the emergency department. Okay? Lidocaine works as an anesthetic and also as a sodium channel blocker. Because when you block sodium channels in the nerves, you don't feel anything. Why? Because the nerves cannot depolarize. If the nerves cannot depolarize, when someone has a laceration, you want to stitch them up, you inject lidocaine into the wound, the patient doesn't feel anything. You can throw stitches and you can throw needles through their skin and they're like, I don't feel anything. Yeah, so we use lidocaine for that as an anesthetic, but it's also used in ventricular arrhythmias. Really? Yeah. So what kind of ventricular arrhythmias are we talking about? Ventricular. What's going on in the ventricles again? Ventricular arrhythmias. Well, we're talking about ventricular tachycardia. Ventricular tachycardia. Ventricular tachycardia. Okay? So patient has V-tach, you can also give them an intravenous lidocaine. Right? It's not the one, the local anesthetic one that actually has to go intravenously. Okay? Now, one of the side effects on the EKG, it does have no effect on the PR interval, and it has no effect on the QRS, but it has effects on the CNS system. So adverse drug reaction, CNS. So you can get drowsiness. Okay? Patients can have nystagmus. Nystagmus means you tell the patient to look over that way and their eyes kind of tracking. Okay? When it's tracking like that, that's called nystagmus. Okay? They also develop slurred speech and convulsion. Convulsions or seizure. Why? Because if you block sodium channels in the brain, the action potential can be fired through those neurons and the patient can develop seizures. But nystagmus, if you see nystagmus, that's early sign of toxicity. Early signs of toxicity. Okay? So let's talk about tokenamide, right? Tokenide. So, drug name, tokenide. Well, we really don't need to memorize what it does because we already spoke about that. What do we need to know about tokenide for the boards? It's also used to treat ventricular arrhythmias. Okay, ventricular arrhythmias. So basically, they all pretty much do the same thing: ventricular arrhythmias, ventricular arrhythmias, ventricular arrhythmias. So if I can summarize it before we go to the end, you can say so far all these drugs works on ventricular arrhythmias. The first three also works on supraventricular arrhythmias, but these guys are primarily working on ventricular arrhythmias. Now, tokenide has side effects, and its side effects, so this is ADRX, means adverse drug reaction. On the heart, it can cause bradycardia. It can slow your heart rate down and causes bradycardia. It can cause an AV node blockage and also can cause hypotension, low blood pressure, hypotension.